Achilles tendon ruptures are kind of classically happen in the weekend warrior type athlete. The blood flow to the Achilles tendon as you age gets less and less robust, and the tendon starts to break down. And so when you haven't used and remodeled that tendon all the time and then go to play something on the weekend with your buddies, sometimes that's a weak point in the tendon and can rupture. There are operative and non-operative treatments for an Achilles tendon rupture. A lot of our kind of early motion rehab protocols have helped a non-operative option for Achilles tendon be a very reasonable option. Operatively, there's two approaches. One is to do an open repair with a longer incision where you suture both ends of the tendon together, and then there's a percutaneous repair where you make a smaller incision, place a guide over the tendon, and either pass the suture or pass the fixation suture percutaneously, meaning through the skin without having to make a big incision, and then either tying those two ends together or anchoring them down to the bone. One of the big risks with doing an Achilles tendon repair is an infection. It's kind of a devastating complication, and that complication is a little bit higher with an open repair because you're making a longer incision. One of the complications of a percutaneous repair is the nerve isn't directly visible for all of the suture that you're passing with a needle through the skin. And so sometimes there can be an irritating nerve injury that can happen percutaneously. Non-operatively, the downside are, according to some studies, you lose a little bit of the explosive power that you otherwise would have. Classically, there's a higher re-rupture rate for non-operative treatment. One of the other tendons that we repair is a distal biceps tendon. This often happens in a little bit older patient who, grabs something or does something a little bit out of the ordinary and flexes that biceps tendon. It typically has a little bit of wear and tear in the tendon before the actual rupture happens, and a rupture can happen. One of the things that tearing the tendon from the radius bone is that the muscle pulls up. It's called like a Popeye sign or Popeye deformity, where you have like the muscle bulges up here. Similarly, if you tear the tendon up by the shoulder, the muscle sags down a little bit because that tension is gone. For a distal biceps tear, you can treat it non-operatively. You may theoretically lose a little bit of your flexion strength, but it's really the supination strength, like a screwdriver type motion, that the patients lose quite a bit of strength with. We're able to repair the tendon with little anchor or a button that goes through the bone, and we're able to take the tendon, which sometimes is clear up in the arm, bring it down and reattach it to the radius bone and kind of restore the patient's strength and function. One of the things that we commonly treat are basic fractures from ground level falls, from car accidents, from sports or other injuries. One of my favorite things to see is a patient that comes in with a major fracture. They can't walk, they can't really get out of bed or move, and then watching them get the fracture fixed, and every time we see them on follow-up, they are better and better and better. It's really satisfying to have a patient have a major like hip fracture or leg fracture, be unable to walk, and then see them walk into our office 3 to 6 months later. For fractures, our job is to get the bone to come together and keep it together with plates and screws oftentimes, and let the body heal the bone. The bone is incredible, and if the bone heals, it will last them theoretically forever. If the bone doesn't heal, it doesn't matter how big the plate, how big the screws, how strong the fixation, the metal doesn't have any regenerative capabilities. So in time, a metal component will fail if we don't get the bone to heal. And so one of the things that we are always telling our patients is to get a DEXA scan, to get your calcium and vitamin D supplementation, and see your primary care doc about treating the biology behind bone healing, in addition to the immediate fracture and getting mechanically the bone to line up and fit together.